There was a mother's son who was getting a procedure done, and the surgery was supposed to be good, it was supposed to be straightforward, and it worked out well, and he was having a great recovery. Although he did need a PSA, which is a patient-controlled anglesia pump. And what that does is it's a patient-controlled, so it releases morphine on the command of the patient. And then one day, the pain team came to see how he was doing because of the discomfort he was feeling. And because of that, they increased his dosage of morphine, when his nurse that was taking care of him suggested not to increase the dosage, but the pain team disregarded that. And the mother noticed during their conversations he would doze off a lot and his behavior wasn't normal. So the mother went to go check in with a charge nurse to ask what was going on, and the charge nurse let her know that this is normal, it's a natural reaction when someone goes under morphine. Later, the mother was given a call by the hospital and informed her that her son went into cardiac arrest. Her son did not make it, and little did she know that would be the last conversation she would ever have with her son. Hello everyone, my name is Andrea, and today we will be focusing on patient safety. This is a health issue that's going nationwide and is becoming an epidemic. Today we are going over the topics of what is patient safety, why there is an issue in patient safety, and the solutions in providing effective patient safety. So what is patient safety? Well, according to WHO, the World Health Organization, they define patient safety as the prevention of errors and adverse effects to patients associated with healthcare. Patient safety affects everyone who has ever received care from a healthcare system and even family members of those who are receiving the care. Issue that has been noticed is the effects of not providing patient safety, which leads to medical errors, decline in patient health, and even death. One of the leading causes for lack of patient safety is communication. It is commonly reported that 1 out of 10 hospitalized patients experience harm, with a 50% preventability. WHO has recognized that patient safety has become an epidemic across the world. And because of this, they have made a commitment to improving patient safety by launching a World Alliance for Patient Safety campaign as a solution. Some other solutions that are being made are nonprofit companies such as the Joint Commission holding standards for health organizations in the United States, which include patient safety. Other solutions that companies, organizations, industries, corporations, etc. hold workshops that increase team building skills, which include communication. Effective communication is critical to successful delivery of healthcare services, as said by the Joint Commission 2017. Not many realize how important communication is when providing patient safety. After having a discussion with a nurse that I work with, they have told me their own personal experience as to how lack of communication affected his father's care. His father had been feeling very weak and was being treated for his high blood pressure. But as it turns out, when the nurse went to go visit his father and saw all the medication he was taking, it was alarming to him that he was taking 5 prescribed medications that were all very similar and was a cause as to why he was feeling very weak. The nurse had found his father was being overprescribed the same medicine treating his father for high blood pressure. It affected his health even more. The nurse was upset that the doctors had all prescribed similar medicine and had not taken into account the other medications that his father was taking. When caring for a patient, it should be a team effort. Everyone should be communicating with one another and even to the patient so they are aware of the care that they are receiving. And as a solution for preventing medical errors and providing patient safety, healthcare systems should have workshops for employers and continuing to have the Joint Commission and WHO to spread awareness and education to their employers on patient safety. I hope the stories that were shared through this presentation show how patient safety can save lives, and enhance communication skills is important and vital to providing care, to prevent situations such as a mother who lost her son, and even a nurse who almost lost his father. Thank you.